Good evening, everyone. I really couldn't make out what Fatima was saying about me, but I'm sure you said some good words. Thank you so much for that. And the topic on which I would be talking today is what Sanjeevani is doing in India in the space of cancer care and why it is doing that. That is the topic of conversation, a little serious as it is. But before that, let me start by saying that Morocco is beautiful. And the people Morocco are amazingly beautiful. So thank you so much, Dr. Monir, Fatima, for giving me this space and making me a part of it. My introduction to cancer started with a report in my hand when I was diagnosed with stage 3 cancer in 2009. Before that, I had seen cancer only in films. I knew nothing about it. And I went through the whole experience of the treatment of cancer, which is extremely aggressive. Also became very lonely, frightening, frustrating, most of the times. And this is despite having all the resources that I had with me. One thing which used to remain with me all this while was that if I'm going through this treatment and finding it to be so challenging with everything around, then how do all those people who have none of the resources, how do they put up with it? So frankly, I went to the balcony twice. I thought I'm like done with the treatment. But this is what remained with me, that there are people out there who are going through a similar or probably a worse experience in life, and I need to go on. And I used to tell my doctor I want to do something for, in the cancer care space. And he would tease me, you are in stage 3. Madam, first you make it, and then you can decide to do whatever. So I did survive, and I survived well. There were 2 learnings which were very important to me during those months of treatment. One was that cancer is a disease which opens multiple fronts for a patient. And all of them need to be addressed, they need to be closed if a patient has to get cured completely. Cancer is the only disease where it is said that you have to fight cancer. Nobody says that you have to fight diabetes. Nobody says you have to fight arthritis. So why it is said that you have to fight cancer? Because cancer wages a war on you. And it works very fast in your body. So you have to work equally fast with all the resources that you can muster, because either you win or the cancer wins. This is not a disease where the doctor and you can keep playing ball for a very long time. Yeah? So one of them has to win, and therefore you have to fight with all that you can create around you. The other learning which came to me was when I went to my doctor after finishing my treatment. The doctor told me that now you are cancer-free, and I asked him, that's great, but now tell me what medicine do I need to take so that I don't have a recurrence? And he said, you can go for your follow-ups. I said, that will take care of early detection. How do I prevent a recurrence? He said, there is no medicine for that. And that day I understood that becoming cancer-free is one thing, remaining cancer-free is another. Becoming cancer-free, the whole medical world stands by you, and they do an awesome job. But remaining cancer-free becomes my responsibility. And if it is my responsibility, then I need to understand it. I need to understand as to how cancer developed in my body, what does it do inside it, what can I do to get around it. And with these two learnings, Sanjeevani Life Beyond Cancer was set up in the year 2012. The first project that we started was from Tata Hospital, Bombay. My treatment happened there as well. And the project was that we will have teams in the OPDs of the hospital. And if any one of you has visited Tata Hospital in Bombay, you are basically fighting for foot space. That is the kind of place it is. The doctor is able to give will you give it to him, please? So the doctor may be able to give you just 2 to 3 minutes. He may not even look up at you, not because he doesn't want to, but there are so many patients that is the kind of time which you get with the doctor. So the first project that we started was that we will have teams in the OPDs of the hospital. What will they do? They will take the case paper, make the patient understand as to what is the diagnosis. How will the treatment progress from there? Provide all the emotional support that the patient needs. Provide all the logistical support the patient needs. A lot of patients have to travel from nearby places to reach the bigger city where the cancer hospital is. A lot of people have to go through relationship problems. They have legal issues. A lot of women are deserted by their families. So there is so much which is happening around. And this is the, will you go back, Anil, to the earlier 2 slides? So the earlier, earlier. So after we started this project and we worked on it for 2 years, I decided to commission Nirmala Niketan College of Social Work because I wanted to know the kind of impact that this program is having on the people. Because I was working, my job was very demanding, I have a young family, so if I'm giving my time to something, I should be giving it to something where it is worth its while. And the sample size of the thing was 222 patients. And we have focus group discussions with doctors, caregivers, the hospital staff, and of course the patients. Now, what came out is this, that these are the primary needs or concerns of the patients. If these are the primary needs and concerns of the patients, this full study is available on our website. What also came was that 77% of the patients said that we could not have gone forward with the treatment if these needs were not met through the program that you are running. So this gave me the kind of confidence to continue the work that we do today. So Sanjivnney was started not only out of an emotion, But the survey work which we did with a lot of due diligence and which is creating the impact. Once Sanjeevani was born, one thing was very clear in my head, that if all those issues need to be addressed, then we have to work towards integrative cancer care. At that time, I didn't know the term integrative cancer care because cancer was not talked about as much. Integrative cancer care was not talked about much. But I was very clear that we need to cover the full spectrum of cancer care space if the patient has to benefit. Because if we don't make everything available to the patient at once, then we are losing the opportunity. We are not giving him everything that he or she will need to put up the fight. So it'll become like this, that you send your child to a school and you only have maths and English classes. Do we want to do that? No, we want football as well, we want swimming as well, we need extracurricular activities. Why do we want all that in the school? Because that leads to overall development of the child. Here we are fighting cancer. So the least a patient deserves is that everything that can work on him or her is made available to her. And that is how the integrative cancer care model started, which starts from prevention, going to diagnosis now, to cure, to rehab. I will show you in the next slide the programs that we run, which cover the whole patient cycle. From prevention to patient assistance in hospitals, holistic healing, rehabilitation, and lifelong support. Now we have started research and advocacy for the past 5 years because we do a lot of impact study, and we are trying to send those to various places so that people can learn from the experience that we have. We have worked with more than 1.35 million patients by now, and we work with more than 1,000 patients every day. So that's the kind of experience we have with patients. The first program that I was talking to you is Can Sahyogi, which is now running in 33 hospitals of the country across 16 states. And the idea is to expand more, but as of now, everything a patient needs in the hospital to put up a good fight is made available through this program. The second program that we run, I would like to take half a minute to tell you as to why that program is there, which is called Srajan and Satori. The only difference is Satori is for underprivileged patients and Srajan is for educated patients. Otherwise, both of them are programs which focus on holistic healing. I myself have been a yoga instructor for a very long time. Despite that I had cancer, I needed to understand as to what was going wrong. And once you have a crisis like that, then the whole practice of yours changes. The whole intensity of the practice changes. When I was going through my treatment, my first chemotherapy happened. The second was about to happen. One of my eyes swelled up and it became like a wound. I was not able to open it. It would hurt like hell. And I didn't know what was happening. I went to the best eye doctor in Bombay. I was being treated by the best of the oncologists in Bombay. Nobody could tell me what was happening to my eye. Where is the connect? And then the third chemotherapy, when it had to come, again the eye became a wound 6 days before. Same with fourth, fifth, sixth. The eye continued to become a wound if my chemotherapy had to continue, and it came 6 days before the next chemotherapy. And then I understood that it is my fear somewhere in the subconscious mind of the chemotherapy which is creating this eye condition. And if with my mind I can create a wound, then with my mind I can also heal a wound. I can deconstruct a tumor. There lies a huge possibility out there. And that is how the Satori and the Srajan program started. It basically rests on 3 pillars, which is food, breath, and mental constructs. So we teach people how to work upon themselves to take care of the side effects and to reduce the chances of a recurrence substantially. Since we work with underprivileged patients, a lot of patients are not able to get the food supplements that we talk about. All of them are in natural form. So we adopt those patients for the whole period of their chemotherapy. They remain with us, and that program is called Canahar. Next time, in case I become a part of this conference, I would love to present a study on Canahar, because we are already seeing how the weight of the patients is maintained, how their platelet count is maintained, how their hemoglobin is maintained with the ingredients that we supply them, and we teach them how to use them. The next programs which are there, because there was one concern in the initial survey, which was of unemployment. So therefore, because a lot of patients, they have to forego their employment. And so we have a 6-month certificate course where we train cancer survivors to become professional cancer caregivers. So it is 120 hours of theory and 240 hours of practicals. We are running the 16th batch of that right now, and 98% of the participants, successful participants, are employed in the cancer care space. The next program is Aham Sanjeevani, where we train our beneficiaries in a small way to become cancer community leaders and start contributing in the community. We also encourage them to adopt a patient to basically inculcate a feeling of gratitude in them. So apart from these, then we have Can Chetna, where we teach people how to take care of themselves so that an occurrence of cancer does not happen in their lives. And we now have the National Conference on Integrative Cancer Care, which we do annually. And we invite doctors, healers, nutritionists, psychotherapists. In the last NCICC, we had more than 300 patients who participated and benefited from the master classes and the workshop sessions we had. Just the next slide. So this is the coverage that we have as of now. We work with almost 10% of the cancer cases in India right now. We want to increase it to 40 in the coming years. This slide is very important because this shows the impact of the holistic healing program. As you can see, the positive effect increases by 16 to 24%, and the negative effect reduces in most patients from 4 to 10%. When you look at the difference in the physical symptoms, most of the patients, the pain, the distress, the nausea, insomnia, reduce by 16 to 20%. The beauty of the slide is not only on the impact which is shown here, but in this, that when we took the sample size of 32 for this, we also took another sample size of 32 for those patients who did the course with us 2 years back. The most important part of holistic healing is that there is a behavioral change. If the behavioral change is not there, holistic healing can lead to no results. In our case, the findings of the people who did the course 2 years back and the concurrent were exactly the same, which means that whatever people had learned, they had really gotten the gist of it, and they had started working on themselves. In the years to go, we want to increase our reach as much as possible, work with bigger communities, more geographies. And I would request everybody who is sitting here, please do come to Goa next year, become a part of our NCICC. I'm sure we will learn a lot from you, and I'm sure you will take some experiences back which will be worth their while. Thank you.